Welcome to Coping Together, Mental Health Association of Central Florida's live web series dedicated to helping you develop coping strategies and wellness tools related to COVID-19, as well as talk about mental health. Coping Together was created in response to COVID-19's mandatory social distancing orders. This show seeks to learn and educate. We do not speak for any particular group. Overall, Coping Together serves as a platform through which we can demystify and unpack mental health concepts and hear from experts in the field. Please note that this show may discuss sensitive topics, including but not limited to sexual assault, suicide, and various traumas. If you find yourself feeling upset or struggling during any episode, listen to your body and pause the input. We will post related resources. Remember, it's okay to get help.
Hi, everybody. Welcome to this week's episode of Coping Together. I'm your host, Faith. I'm very excited, as always, to talk to you all about topics related to COVID and other things mental health-wise. Today, I'm very happy to introduce our guest, Melissa Callahan. She is the Chief Nursing Officer with the Retreat Behavioral Health. Melissa, how are you doing today?
I'm great. I'm glad to be here. I am
Wonderful.
very passionate about this, so thank you for having me.
Of course. Thank you so much for being here. So can you tell us a little bit about yourself before we get started?
Sure. I'm an adult and geriatric nurse practitioner. I've been in the field for almost 20 years, and I've been working with a specialty of behavioral health, addiction medicine for the entire 20 years. So I've been doing this a long time, watching a lot of the changes, and 2020 has definitely brought new light to many of the disease processes and human nature and fear and how we accommodate with it or not.
Yeah, absolutely. And so that's actually a really great segue into our topic for today, which we're here to talk about substance use and COVID-19. And I'll actually start, I guess, by really asking the question, what is the difference between, general substance use and the line of substance like misuse or substance abuse?
Substance abuse. So, let's talk about the abuse part. We know what use is. People are using something. So abuse by definition is if you're using something that is illicit or illegal, like heroin, cocaine, drugs of that nature. If you're using something that's not prescribed to you, then you're abusing it. If you're using more than what's prescribed or recommended, so we'll say recommended for like alcohol, or if you're taking prescriptions, if you're taking more than what was prescribed to you, then you're abusing it. And then if you start using it in a way that you're not supposed to, so if it's a pill and you're just supposed to swallow it, if you start chewing it, if you start snorting it, that's when you're getting into the level of abuse.
Okay. So I guess one of the things that I want to ask you, and I don't even know if it's possible to really identify this, but is there a way to find the line between that normal expected usage of something and then when it hits the point of, possibly negatively impacting their lives or the lives of their loved ones?
Yeah, it's not clear cut, but in definition wise, when someone starts abusing something, you will know it when they start to become tolerant often, which means that the body needs more and more to get the same effect. And that usually is reversible. But if you start drinking every single day, then when you wake up 30 days later, you're going to start needing to have that drink every single day. So tolerance will build up. Once tolerance builds up, you can get into the position of dependence. And dependence is more of a physical presentation. It means that if you don't take that same amount that you're used to, or if you try to stop, you will actively withdraw. You will have symptoms, and if it's alcohol, it can be severe and require medical management. And dependence does not always turn into addiction, but if you continue to use generally more than 6 months at a dependent level, then you will become addicted, where you will psychologically, in addition to physically, become dependent on the substance. So you oftentimes will see psychological changes. You know that there are repercussions. You know that there are adverse effects if you continue to use, but people continue to use because they now have abnormalities in their brain chemistry in addition to physically being dependent.
Okay. And how does COVID play a role in this? It's kind of a vague question, I know, but with it's not.
Yeah, COVID has created, definitely the words I use most often are fear isolation. So if you have somebody who already suffers from any behavioral health diagnosis, whether it be an abuse, addiction, or depression, anxiety, we now have exacerbated it by having people being isolated, not leaving their homes, and then adding to it fear of numbers of people being sick, of people dying, of wherever you go, fear of germs. People who already are, conscious of germs, I think it's gone to a whole nother level. So I think that the people who already had diagnoses have been definitely seeing exacerbations and challenges of maybe having delayed access to care, not being able to get in to see a doctor, a nurse practitioner, your psychiatrist, your therapist. We as a world have tried to accommodate and create telehealth opportunities, but some people really need people contact. They need to be out and about. Just being in the house and isolation exaggerates their disease process already. And then for people who didn't have a substance use disorder or didn't have an active mental health diagnosis, now with COVID have developed that. Fear creates a lot of anxiety and depressed mood and helpless, hopeless feeling. So we now have a whole new set of the population who's suffering from behavioral health, in addition to people who already had it who are being exaggerated. So COVID-19 has definitely put challenges in front of us that we really don't know all the answers. We are learning as we go along, and we're trying to meet people where they are, because people are in very different places with their experiences and their reactions to COVID-19.
I agree with you for sure on that, like you said, that difference for everybody. And so what are the potential ramifications, or are there potential ramifications when COVID-19, I don't want to say ends, but like settles down a little bit? Are we going to, still see that group of people that, like you said, it's new to them to have this kind of dependence? Are we going to see that continue most likely? How do you anticipate this is going to affect us as a community and, individually?
I think we have the next 5 to 10 years of a new presentation of behavioral health illnesses. I think that self-medication has been a huge driving force for many people in society right now. And that's not just self-medication, meaning drugs. People are overeating, over-drinking, excessive use of nicotine, in addition to prescriptive pills, whether they're actually prescribed to them or they're taking them from someone else, using illicit drugs, marijuana. So the more people are not active or being able to, have some normalcy of places to go every day and be accountable, they're increasing their use of all of these substances. And you will actually withdraw from all of these substances. So right after the strict quarantine, everyone's talking about all the weight they gained, and you actually withdraw from the eating habits that you had while you were in quarantine. So I think as a society, we probably overindulged during this time, whether it was a form of self-medication, whether it was a form of boredom, or just this abrupt change that we didn't have a control over.
Yeah,
and
the things you do have control over is what you put into your body. It's your choice.
Right. So I think that we are going to experience many levels on the spectrum of behavioral health, from new depressions and anxieties. I think there's a lot of trauma. I think there's a lot of chronic trauma for our healthcare workers, for people who experienced death very close to them. And I think we have a lot of work to do. Therapy, medication, the medical community, recognizing it, and then beginning to address it. Behavioral health tends to have a lot of stigma associated with it. You need to get tougher, or it's associated potentially with a weakness. If we've never seen more evidence that that is not the case, that there are brain diseases involved, this is the time. I think that we have a new light being shed on behavioral health medicine, and research is going to be unlimited, not only on COVID-19, but now how people are reacting and what are the treatment options.
Mm-hmm. Especially like prevalence is increasing, probably even more. And people often choose research that's close to their heart or something that they're just interested in. And like you said, just the sheer number of people affected by it or with loved ones affected by it is unfortunately, going to increase. And so with that, I agree that there's probably going to be a lot of research and things like that.
Yeah, it's behavioral health medicine, psychiatry has always been difficult because there's not an easy referral source system. So I'm a primary care nurse practitioner. That's the basis of my education. When I'm in the office and I have somebody who needs to go to a cardiologist, I have cardiologists that I've worked with, I refer them out, but it's not as easy with behavioral health. Insurances don't cover the mass services that are needed. Therapy, it's very difficult to have referral sources with confidentiality, and there's just, I think, a lack of communication, a lack of access, and letting people know what the options are. I think it's really hard to have symptoms of maybe like oversleeping and overeating and just not wanting to get out of bed. It's hard to go tell a professional, this is what I'm experiencing. It's much easier to say, I've had a cough for 3 days and I have a sore throat and I had a temperature. They seem like more quantifiable symptoms that you can do something with. Behavioral health is not that way. And we can talk ourselves into, oh, it's just going to get better, or it's not that big of a deal, or, I just got to snap out of it. And we are not in that situation. If your brain chemicals are altered, there's much more that's needed. There's medical support that's needed, therapy support that's needed.
I appreciate you saying all that and touching on that, because I do agree with you that so much of it, like I said, we're here to talk about mental health, we talk about substance use, substance abuse, but it all ties back into, like you said, it's that brain chemistry and kind of associating it with almost like a physical ailment. When we go to the doctor and say, I've had a cough, like you said, it's okay, here's some medicine, or, drink some orange juice. I don't know, I'm not a doctor. But it's different when you like you said, you look into behavioral health, especially when you look at psychiatric medication, and the fact that, there are different things work for everybody. I mean, it's similar with physical health as well, but then people go home with behavioral health and they might, like you said, self-medicate. And that's where I think, we can tie that back into substance use again. Right. So I thank you for making that point.
Yeah. It's definitely a struggle.
So my last question.
Yeah.
Yeah. Sorry about that. I didn't mean to cut you off. But so my last question for you, you talked earlier and you said something, and I think it's something that I for sure wasn't aware of until very recently. And that's that, those drugs or those substances that we can consume that aren't illegal, like alcohol. You even mentioned that someone can experience a withdrawal from it. And so with that being said, not everything is safe, depending on the drug, depending on the substance, to quit it cold turkey. What things should our community, be aware of and consider regarding this as we move forward?
If it's alcohol specifically, alcohol actually can have lethal consequences. So if you've been drinking consistently and you decide you need to cut back, or, you're going back into the work setting and it's, you have to change what you had as a new norm, and you wake up in the morning and your hands are shaking and you're sweaty, that's withdrawal. You need to contact medical professional help and make sure that you are safely coming off the alcohol. You can't just decrease it a little bit each day and it's just going to work and everything's going to be great, because everybody has a different reaction. Everybody has a different, complication. And you really have to seek medical help. If there's anything that you've been taking with a really consistent basis, you really should consult your primary care provider and just have a conversation. I'm starting to notice this, maybe I'm physically dependent, and am I at risk, and what should I do? If it's prescriptions and you always follow medical advice, if you're prescribed a certain amount and you feel like you want to come off or stop taking it, you definitely have to find out if it needs to be titrated or a medical professional needs to manage that. If it's tobacco or food, of course you have to really take your time and decrease the amounts, but you have to be careful. Fortunately, the worst case scenarios in those two is you're very irritable and short-tempered. Your physiological withdrawal is not life-threatening, but knowing that it will happen. People don't understand what's happening when it's happening. Having an understanding and knowing that, I think, is so very important.
Yes, I think you make an excellent point on that. And I, just to kind of close with that, I think that so many people, myself included, we're all here to learn. That's the whole purpose of this show is, I'm here to learn and share that with the audience of what information experts like you have to give. And so I think that a lot of people, or at least myself, have associated often like withdrawal with hard drugs. I don't think anybody considered, or at least the majority of people I think haven't considered that those circumstance actually spreads out to pretty much anything we put into our bodies on a daily basis.
Right.
So with that being said, I thank you so much, Melissa, for being here. If any of you have any questions about the show, please feel free to reach out to us. I will put our links in the description, as well as any links for the Retreat Behavioral Health. If you have any questions about that, please feel free to check them out. And if you have any ideas about topics you want to hear, see, please, reach out to us. Thank you so much for watching. You are the reason that we're able to do what we do. And same to you, Melissa. Thank you so much for being here.
No problem. Thank you for having me.
Thank you. You all have a great day, and we'll see you next time.